Good. All right. Welcome to the Uncommon Sense podcast. I am your host Blake, and today with me I have a very old friend. I've known him since I was 15 years old. I've thrown up in front of him many a times. My buddy and lab tech for Government of Canada, Mr. Ryan Rosewell. How are you, buddy?
Hey, good, good. Yeah, so Blake said, I am a medical laboratory technologist, and I work at the ERLA Labs, the Eastern Ontario Regional Lab Association. And right now, I've taken a temp job to work in the COVID lab for testing.
It's crazy. So, I mean, obviously, COVID's been like the biggest thing that we were being talking about, and probably will be the biggest thing we talk about for probably the next couple of years, at least till we get a handle on it. Um, with everything that's been going on, I think the biggest problem that we're having is communication. The public, has a really hard time getting a hold of factual science. Aside from those who really kind of know how to like decipher, like a scientific paper, or who understand medical journals. The whole thing a lot of people are having trouble with is because the government's saying like, well, you can't go to work, you have to stay home, or you can work but you can only work within these terms. You can't travel here, you can't go there, you can't gather in groups, you can't do this. I think we all kind of understand how that all works out. But what I think a lot of us are truly not understanding is um the spread of this virus, and how, like, when we're at the most vulnerable kind of thing. You know what I mean?
Hmm.
So based on, like, all your lab work, and you doing all your stuff, and deciphering everything that you guys are looking at, um what has been like the one thing that's kind of what's been something that you feel like the public should kind of know, but maybe is either getting wrong or is not really kind of holding to fact kind of deal?
Well, I mean, we all know that the virus spreads really rapidly.
Hmm.
And I think, when you look at the numbers that are published, you see the case numbers rising really fast,
Hmm.
right? Um, but mortalities have kind of tapered off a little
Okay.
bit, because we're having way more infection numbers now than we were in March or April.
Correct.
But the mortality rate is still kind of low. It's rising, yes, but it's not as high as it was, and that's just simple evolution, right? Early in the early days, we didn't know how to treat.
Hmm.
We didn't have any kind of methods to treat the
Yeah.
cases that were mounting in the ICU,
Keep going, I'm listening.
and now we have some effective treatments, and we know how to manage the cases better. So I don't think the mortality rate is as big as it used to be.
Okay.
And we also have an effective lockdown, which, if people follow it, um, you're not going to see as many people getting sick. And that's why it's so important, because if we were just allowed to do whatever we wanted, you'd have the virus spreading like crazy, just kind of like in the United States.
Right. And so, like, in the United States right now, like, we can see, because I don't know, their information is super misleading. Like, in some cases you get, like, New York and LA are talking a lot about, we have mass infections, and we're having all
Mhm.
these issues. But then you have places like Texas, where in some papers, some journals, they're saying that Texas is having a widespread issue with COVID. And then in
Mhm.
other ones, they're saying, nah, it's not so bad. Like, we're fine. Like, we wear a mask, we go around, we're open, we keep doing the same thing we're doing. It should, it's okay. Um, with your guys' testing, um, like you said, because we're starting to see the numbers go up, but we're essentially creating these lockdowns, and trying to um, trying to stop the spread as much as we possibly can. Um, what is the science telling us, at least from a standpoint of where if we're doing these lockdowns, but it seems like the numbers are increasing. Is this like a situation where maybe we've reacted too slowly? Is this just something that in a natural progression of a virus will just this is what it's going to do? It's going to continue to kind of go this way, or are we just kind of not doing these things like are we not doing something properly that's kind of that's allowing this thing to keep on flourishing the way it is?
Well, I think it's a number of things. Like the whole point of the lockdown is to slow everything down, to buy time to vaccinate the population,
Right.
right? Is to just, make sure that it doesn't mutate and change into something that's new, like you're seeing with the UK variant. Uh,
Okay.
the longer a virus stays around, the more chance it has to mutate and develop into something different. Now, it
Mhm.
could be worse, it could be more mild, like it depends on how it evolves.
Mhm.
Um, but I think keeping the lockdown, what are we doing wrong? It's not everybody. I think by and large, everybody's kind of compliant, at least here in Canada, from what I can see.
Mhm.
But, because the virus is quite contagious and it spreads very rapidly,
Mhm.
it just takes one person to go somewhere with a group of people, and then all of a sudden it spreads to those individuals, and then those
Right.
individuals, because it takes so long to develop, it's
Mhm.
not like something you get sick right the next day. It might take 3, 4, 5 days, even longer sometimes, to develop the actual symptoms and to know, okay, yeah, maybe I should go get tested. But in the interim, you're spreading it,
Mhm.
right? So that, and those people don't know that they're sick for another 3 to 4, 5 days or whatever it is. And so that's how it spreads so rapidly, because people
Mm.
don't know. It's not their fault.
Right.
It's just that that's just the nature of the virus.
Interesting. Um and then so like in the spread of the virus, does it is there like an incubation period for it, like necessarily like is it for instance, so if I'm exposed to COVID and with someone's like it and for whatever reason, they spread it to me, is there a like what's the time frame before I start becoming able to spread it as well? Like is as soon as it gets to me, like is it like a day thing and then I can spread it to other people right away? Or does it actually have to infiltrate my system for a little while, incubate, and then make it like 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 a regular flu, right? It spreads because I sneeze and I project the stuff in the air. But
Exactly.
does this follow that same kind of thing, except it's just more like it's more passable, or is it just or is it like does it go right away?
Yeah, so I think you're right on the money. It's exactly the same. Well, not, I don't want to say exactly the same. It's similar to the flu.
Right.
That's the same way you're spreading it via droplets, by
Hmm.
sneezing or coughing or touching your face and then touching an object that somebody
Right.
touches. That spread is the similar to the flu.
Okay.
Um, uh, but you're almost right on the same pathway, because the flu develops quicker, or other
Okay.
viruses develop quicker,
Right.
and your symptoms come on quicker. And I think in COVID's case, it can take longer for that to happen. But that
Okay.
doesn't necessarily mean that you're not spreading it during that interim period. There is an incubation period. I'm not sure exactly the exact length of time it is,
Right.
but it is longer than, let's say, your typical cold or flu.
Okay. And then so in the lab when you guys are looking at this, because so you guys have discovered obviously this UK variant, that is, I guess they're saying it's more infectious than the previous one, like it spreads faster
Yeah.
than the current one does. Um, I know nothing about science. I mean, you know me, I'm a dum dum. But so what I was reading in some journals is that they're hypothetically saying for a virus to become more spreadable, it actually weakens itself a little bit more. So it's not as aggressive as say the original strain is, or at least they're theorizing that it's not as aggressive as the strain. And some are theorizing saying that it could be better because there's less chance of it resulting in harsher symptoms, uh, it'll be more manageable for people to deal with.
Mhm.
Um, is that at all true? Like, is that all something that is plausible, or is it just people trying to kind of, you know, hope for the best that this is gonna somehow fix itself?
So yeah, it is plausible. It's possible, but we
Hmm.
right now in relation to like what you said about the UK variant.
Yeah.
UK variant, all we know is that it in lab settings that it spreads more quickly. So they've done some preliminary studies in the UK
Hmm.
just to show that in a lab, yes, it's a little more contagious than the other one or the regular variants that they have in the UK.
Okay.
Um, However, um, mutations are not necessarily good or bad. Sometimes they're just like the same, right? The
Okay.
mutations happen; they could do nothing to it, or they could do make it worse, or they could make it even more mild, like you were saying. So it just
Right.
depends on what happens.
Like what happened, like how it actually mutates itself. Like there's
Exactly.
no
So
there's no
whatever,
marker. Right.
yeah. So whatever
It,
gene gets mutated, it may give it an advantage. Like
okay.
in the UK variant, it gave it an advantage in the sense that it can be more contagious than the
Okay.
previous strain. Sometimes you can have a mutation in a gene and it does absolutely nothing. It's exactly the same, only one little portion is changed.
It's just like a minor variant.
Yeah,
Okay.
it's like a minor change, and that happens naturally. Like
Right.
this is a
But
natural occurrence.
okay. Um.
But that's what just to drive home the point.
Yeah. Yeah.
Like we don't want to, from earlier is that we don't want this virus to be spreading around forever and uncontrolled, which is why we're doing the lockdown. Because if it's
Correct.
uncontrolled and it's just staying around in the population for longer and longer, then there's
Correct.
more opportunity for mutations that may make it worse.
Correct. And
So
then so
that's the
yeah.
whole
So then
point.
okay. And then so one of the terms that gets thrown around a lot is herd immunity.
Yeah.
A lot of people talking about, like, you know, well, if enough people get sick of this, eventually we'll develop some form of, you know, resistance to it. We'll pass it on to our kids won't get as sick from it, so on and so forth. um so but in saying that, like, doesn't that mean, so how is that going to work out in terms of, I guess, because we can't stop ourselves from getting sick from this, like, as much as many um things as we put in place to try to prevent people from getting sick,
Mhm.
um we're still going to get sick. Like, I think they said the majority of the population of the world is still going to get COVID. It's just trying to manage, um not getting overrun, not having hospitals overrun, not having people, you know, in uh assisted living homes and stuff dying, because they're the major people who are affected by this the most.
Quite. Yeah.
um but so then, what is it going to take to get to that herd immunity level? Like when would they theorize that we would actually get to a point to where we could consider ourselves herd immune?
I'm not sure of the exact point in
Yeah.
relation to this particular virus, but the stuff that's been floating around about vaccinations and such, that we need about 70 to 80% of people to be inoculated in order to really stamp out the virus.
Okay.
Now, in terms of herd immunity, like I think that's a term in relation to like if we had let the virus just pass through the population, and eventually enough people will build immunity to it, and eventually the virus will slow down because there's enough people that are already naturally immune to it. Uh,
Right.
the vaccination process is trying to um, get enough people to that kind of herd immunity sort of level
Hmm.
as quickly as possible, but just without the death part. That
Right.
if you were to let it go uncontrolled for 10 years or whatever amount of time, like 2 years, no
Hmm.
control, no lockdowns, no nothing, there would be a lot of people that would die.
Right.
I think
And
that's
then
behind it.
yeah. And then um so one of the things that I heard people saying, because there was like this, I was listening to this stupid thing anyways, it was just a bunch of people arguing about it, but
By the way, I just want to clarify, I'm
Yeah.
not an epidemiologist,
No,
okay?
no, 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 no,
I'm just
and
basing
I'm not
this
saying,
on
yeah,
my
yeah, and
knowledge, okay?
for sure, yeah, for sure. But it's more because the reason why I wanted to talk to you was because um, you're seeing the numbers, so you're seeing the math of the whole situation being in the lab,
Yes.
right? So like for me, you're a lot more of an unbiased opinion to this because you don't really have a foot in either camp. Like you're
Okay.
not an epidemiologist, you're not a virologist, you're not getting caught up in that whole scene. What you're doing is just seeing the end result. Like
Correct.
you guys are testing, you guys are getting your results back, and you guys are basically just looking at numbers. Like you're
Yeah.
just saying like they're getting affected here, they're not getting affected there, they're doing this, they're not doing that, so we can surmise
Hmm.
this. You know what
Well,
I mean?
yeah.
That's why for me that's what it is, because I think the biggest problem that we're another thing we're having, I mean it's been a problem all throughout 2020, is the whole social media dynamic, trying to, push a narrative, trying to get this. And I mean, listen, COVID death, COVID dying is a huge thing. My cousin got COVID. She couldn't smell. She got very sick. A couple of my friends have gotten COVID. They haven't felt well either. They've dealt with a lot of problems as well. And they're all worried about residual effects that will happen later on. Whether their body, whether something is going to go haywire
Yeah.
or whatever it is. But the one of the issues we're seeing though is, and especially like we see it from the Quebec government, is we're getting a lot of like sway as to like what we should do here, what we shouldn't do here, how we should handle this, what we should do with that. I mean, for instance, in my case, like I'm a personal trainer.
Hmm.
They've shut us down. They said we can't do gym classes, and for the most part, we understood. We got it. We were doing as much as we could to keep people apart so that people weren't breathing and talking on each other and that kind of stuff. We were being very strict and stringent. But again, people are scared. They don't understand what's going on. The science is still fairly new, so they don't want to take the chance. I'm cool with that. I understand. But then at the same time, when you then are allowed to go to see a masseuse or a physiotherapist, or you're allowed to go see some girl to get your nails done, and you're allowed to, there's, or you're allowed to go into a mall for up until, you know what I mean? It's like, I understand if that's what our aim is to be safe. But if you're going to stop me from living and having my livelihood, then how are you not stopping all these other people in the same respect? Because if you're afraid of me as a personal trainer who can stand 3, 4, 5 feet away from my client and still instruct them properly, but you're not going to stop an esthetician who is literally breathing on somebody's hands, or a masseuse who's literally physically touching a person. You know what I mean? And it's not even a situation where like if someone is like massaging or doing something, even if they have a mask on, like they've still shown that there's still a viral load that can still get through the mask and it can
Of
still
course.
spread. But it's not like a situation where it's like if someone's simply like breathing on your hands, okay, you can wash your hands, maybe get rid of the virus. If someone's breathing on you, it's too late. Like it's already infiltrated, it's already on you, so on. So I think a lot of people are kind of in my boots where it's like we're looking for answers scientifically because the answers we're getting from political figures aren't adding up, and it's causing a lot of disarray, and it's got people marching in the streets saying that they don't believe in masks and they don't believe in whatever, and they're fucking crazy, let's be honest. But
Yeah.
like um but
That's right now. That's the best defense we have.
yeah,
Is
that's it.
enhanced sensitization.
That's it. And honestly, if you're stupid enough to just be like, well, masks don't help, well, if masks don't help, then they shouldn't bother you. Like I don't know what you're seeing as some kind of world order where someone's asking you to wear a mask and somehow that's violating your human rights. Like
Yeah.
it's a mask, and by the slim chance that you do stop someone from getting sick because that mask caught enough of that viral load to stop someone from getting seriously ill, then great, and the hand sanitizer helps, obviously. So, but that's a whole other. that's a
Yeah.
whole other situation what we're talking about. But so with how has it been for you guys in the lab? Because I'm sure, like, this thing started ramping up. I'm sure they had a couple of labs that were doing it at the time. I'm pretty sure all labs are probably just strictly almost COVID at this point, like just trying to, test and figure out, where these outbreaks are coming from. But like, so what is it like for you guys now in the lab? Like, are you guys overwhelmed? Are you working insane hours like, the first responders, or is it fairly like kind of controlled?
Well, it's a fairly controlled environment.
Mm,
I would say we do 10-hour shifts,
okay,
uh,
well that's
in
long.
where I am, which is pretty good. And there has been a lot of overtime.
Hmm.
Now it did die down, kind of like not died down, but
Slowed down a little bit.
settled, I should say,
Okay.
probably over the summer. But then it's as soon as school started, or a few weeks after school started, I should say,
Okay.
things started slowly ramping up. Then we had Thanksgiving, and we got another big push and rise in infection rates. And
Hmm.
then again, what we're seeing now, I mean, even if you look back 2 or 3 weeks ago, we weren't anywhere in Canada really. We weren't reporting the numbers that we're reporting now because people went home or had a gathering over the holidays,
Hmm.
and now we're gonna see for the next couple of weeks. We're gonna have a.
There's the little one.
I think, yeah. Hey, how's it going, buddy? All right. Well, he's gonna be an audience for me.
No, it's all right. That's okay.
but but yeah, now we're seeing quite a large rise in infection rates, and like again, it's situational, right? Like I don't even know what people are supposed to do uh, with like people at dorms at university or college. Like,
Yeah.
are they just supposed to sit alone in their room or apartment for all of the lockdown, or where do they go? Do you create a bubble? Like, there's a lot of weird situations out there that may necessitate somebody going home. Uh, you know, now I'm not trying to say that's all of them, because there are some, obviously, like you see on the news, like people having parties and no masking, no distancing, or whatever.
Yeah.
Few
Yeah.
reports like that over
Yeah.
the past holiday period. So I mean, like those, and that just explodes, right? Because then the public health gets on the contact tracing, and then they go, and then, oh, you were high risk, we found a positive here, now you're a high risk contact, now you go get tested. And then they realize they're positive, and then the whole chain continues, right, all the way
Right.
down. And then it spreads like wildfire, and that's what we're kind of seeing right now in the numbers, right? Like a few weeks ago, we weren't reporting thousands of cases.
Yeah. Well, I mean, it's as someone who's kind of studied psych and sociology in school, the
Yeah.
conversation I'm always in, with my girlfriend and everything, is just that it's not that I'm worried about the science. I'm worried about the psychology, and I'm worried about, like, this. I mean, even the WHO came out and said that the mass lockdown that they've been practicing now is not at all what they said for them to do. They said that they should have been doing the rolling lockdowns, locking down sectors at a time, and then if we need to, completely shut down everything. But they've just mismanaged this lockdown in ways that, psychologically and sociologically, you're gonna create um you're gonna create rebellion. So, like, you're gonna have a bunch of kids, and I mean, there's gonna be rebellion regardless, because there just will always, let's face it, like, 20s to 30s, like 20s to 30, they think they're invulnerable, and to some sense they are invulnerable to this thing, because this isn't really affecting them, right? This isn't really their problem.
Well, I wouldn't say invulnerable.
Not invulnerable, but it's less likely to affect them the way it's going to affect everybody else. You know what
Yeah.
I mean? Their immune systems are a little more healthier. It shouldn't, but I mean, you remember when we were 20? Like, we did so many stupid shit when we were 20.
No,
it's ridiculous.
no, I have no idea what you're talking about.
Like, it's ridiculous. Um, but yeah, I mean, that was always going to that on in my mind was always going to be the core issue where we're going to have to deal with, is that you're going to have to manage the population in a way where you shut them down for a while, but then give them some back, some cells, like some semblance of real life, and
Yes.
then shut them down again. This idea of like going from lockdown to lockdown to lockdown to lockdown is only going to result in people eventually saying, you know what, fuck it. If I get sick, too bad. I'm just going to deal with it. Whatever, I can't be locked down anymore because it's in human nature to want to be around other people, and it's in
Oh, absolutely. I
you know
totally get it. That's why they're, I think in Quebec, if you're a single person living alone, you're
yeah,
allowed to associate with one other household or
right,
something along those lines.
yeah, that's
I'm
right.
not as familiar with Quebec's rules
It's a
around.
weird policy, I'll tell you.
Is that what it is, or?
It is, yeah. If you're a single person in Quebec, you are allowed to affiliate yourself with one other household. So let's say like if you're a single person and you want to go back home to your parents' house for a while, you're allowed to do that. They allow that. You're not supposed to gather in groups indoors. You're allowed to walk outside with a group of people. You're allowed to do things outside because I guess it's a lot harder to spread outdoors because it's open air. Um, but the fact that for me, it's like the fact that malls were still open is completely
Yeah,
it's
that seems more of an economical decision than
yeah, and
public.
it's like I understand, but at the same again, I get in this conversation with people all the time.
Go ahead.
For me, if you and you can tell me this from a scientific perspective if this makes any sense whatsoever. But for me, having a mall open, having big stores like Walmart open, is much more risk of spreading COVID than if you allowed the small stores to open, meaning the small businesses to stay open, where they could control the amount of people who come in. They can control when they're open, when they're closed. They're far more likely to clean and keep everything open because they don't want to be fined, because a fine and everything is going to be way more detrimental to their business. I mean, even in a case of if you were to say like a Walmart, I think actually what was it? There was the IGA in not IGA, the Provigo in NDG.
Okay.
Um, they had found three people whom were working who all had COVID. You
Oh,
know what I
wow.
mean? So even if there was a way to, I don't know, reprimand them, say like if they were fining people for knowing they had COVID and working, Provigo is going to pay that, and then that's going to be it, and it's going to be gone, right? It's not going to have the same effect. But if you allow local grocers to stay open, where they can control the number of people who come in and out, you allow small local businesses to stay open to where they can allow stuff like they can control the ins and outs. I think it probably would have been better, and you probably would have had a lot less people so worried or so rebellious against this because there would be a lot more at stake for you fucking up,
Oh, yeah.
as opposed to if you let people into Walmart where everyone's just walking around. Like I shit you not, Ryan. I had to go to the pharmacy because I had to go ship a package to a family member.
A post office or something in there?
Yeah, well, because they do it out of there's no more post offices, right? Anymore. Like post offices don't exist. They're all in pharmacies, or at least around me, they're all
Oh,
pharmacies.
okay. Yeah, in the city. Yeah, yeah.
Yeah, they're all pharmacies. There's no more like local post office you go to. They all live in pharmacies now. I'm in there. Everybody's got masks on, and then there's this one woman. I shit you not, hacking up a lung, like almost right in front of the cashier's desk, and everyone's just kind of like, "What the fuck is going on here?" Like
It's
mask down to here, coughing like, and then pulling down her mask so that she can breathe. I'm like, okay, so I got COVID now. Like that's what it is. That's it. I caught COVID. Like
well, it's kind of like
fantastic,
it's
you
kind
know.
of like the faux pas of our time, or at least now. It's like, what are you supposed to do? I don't think anybody really has formed the proper etiquette on how to deal with a situation like that during the worldwide pandemic.
Well, that's it. Like I don't. I just. And again, I
Well,
think
I've seen
yeah.
some very creative stuff. Like there was a Jean Coutu that I went to over the holidays to get some chocolates or whatever for
Hmm.
stocking stuffers.
Yeah.
And the way they manage is they have a number of carts that match the allowed amount of people in the store. So
Smart.
anyone who comes in gets a cart, even if you don't need it. And that
Right.
way they know how many people are in the store. So if there's
Right.
no more carts, they can't let anybody in
Right. That makes
until
sense.
somebody else comes out and drops their cart, and then
That
they
makes
clean it and then send off the next person.
that makes sense. Like that makes
I
total
thought
sense.
that was a really cool thing. I was like, I
Yeah,
don't need a cart, and they're like, no, it's to manage the number of people.
for
I was
sure.
like, oh,
Yeah.
well, that's a cool idea.
I mean, listen, even when I went to the Nike store, like they had people lined up around and they're like, yeah, we allowed 10 people at a time. They were controlling how many people were in like each section. So when you walked in, they'd ask you, be like, what are you here for? You tell them I'm looking for this. They're like, okay, so you can go to that section. You can go look what you're looking for.
Mm-hmm.
You're allowed to go from one section to the next, but we're asking you that you keep the 6 foot distance, that you don't overcross. And if you see somebody who's doing something, like say if someone's putting on a pair of shoes or if they're handling something, they're like, please wait until they vacate the area before you walk through, or do whatever. Like, they were trying to be as controlling as possible, only letting a certain amount of people in, only letting, you know what I mean? People go in one door, they go out the next door, totally paying attention to everything, which was fantastic. But just, they were doing something along those lines. But then, like again, when you look at like these Walmarts and all these different places, it's like, what, like, I don't understand how this is safe. How can you tell us that we can't gather in a group, which whatever, don't gather, but
Mm-hmm.
how can you tell us not to do that, but then like you're imagining that somehow in these stores, like that situation is not, like my buddy Jamal sends me pictures all the time because he's super pissed about gyms being closed.
Mm-hmm.
Sends me pictures of when he went like when he goes to Costco, and Costco literally has a lineup of people, like I'm gonna say 20 feet long, and these people are like they're there, they're lined up, maybe they're a couple feet apart, but then you've got people just going back and forth through the alleys, same way. So what's the point? Like
Yeah.
you're in an enclosed area with people going back and forth, not respecting distance. You're lining people up 20 at a time, like to get. And I mean, they've got, like, you've been to Costco. Like if
Yes.
you're in the lineup to get paid, you're there for 20 minutes. Like it's not like you walk up to a cashier, you get paid, and you get out. It's not like that. It's you're there, you sit there, you wait, you're breathing everybody else's air, you're in an enclosed area. Like I just don't understand from like government wide, like how do you see this as not an issue, but you see someone who's keeping their small little restaurant, open for takeout or whatever it is, or
Mm-hmm.
this small little shop. How do you see that as a problem, but you don't see this as a problem? You know what I mean? Because
Yeah.
at least,
And just to come back a little bit,
yeah,
because you know, certain people might be a little more rebellious because they're like, oh, why can this be open and this, and then why
hmm,
can't I go to school or go here or go whatever the situation, and then they rebel and then they throw a party or whatever. The
right,
thing, they're like, oh yeah, it's not, the deaths aren't mounting like it used to be or whatever. Now we have treatments and stuff like that. Yeah, that is true, all of those things, and I can understand how someone could perceive it that way. But like you were saying about your friend, you have nobody knows right now how every single individual is going to react to COVID if you do get sick. It
hmm,
could be related to how much load of virus you get or how concentrated it is.
hmm,
You happen to just pick up a few particles and it doesn't get really bad. Is that what causes people to be asymptomatic or just have a runny nose and that's it? You don't know how it's going to affect. Do the people have an underlying condition that makes it worse? Yeah, we've seen that. Like there's all kinds of variations and combinations. So to take your risks and just say, well, I'm not going to wear a mask or clean my hands and I'm just going to go throw an indoor party with 50 people, you're really rolling the dice with your own health because you don't know what it could be or how it will unfold.
hmm,
Right? And no, I don't think anyone really knows that question. They can't pinpoint, okay, well, this age
right,
group is nothing's going to happen to people because we're seeing younger deaths now that there's more people infected with that are younger.
right.
Now you're seeing other low mortalities. I think it was in December or November or something like that. Somebody, a young kid in Manitoba, died or something like
Oh
that.
yeah,
I can't
yeah,
remember the details, and I might have
yeah.
the wrong province or something, but
No, I think he was. I think he was Manitoba. I think he died because he had some kind of pneumonia reaction to COVID, and
Whatever it might be, right? It's
yeah,
like if you feel like you're healthy, but maybe you have an underlying condition you don't know about it, and
that's
all
it
of a
too.
sudden it makes this just brings it out, or makes the infection worse. Like it's kind of like people are looking around and saying, oh well, people aren't dying. Well, that's in effect what the lockdown is doing is
Right.
making sure that the number of people um, that live is greater than the amount that are dying.
Correct.
You know what I mean?
Yeah,
So
for
keep it
sure.
under control.
And then so I mean, you being lab tech, I don't know how much you know about the vaccine, but so for the vaccine, it being, is this the first RNA vaccine that they've ever produced? Like that they're giving to the mass public? Like, is this the first time that, like, do you know if
I'm
this is the
not
first
sure if
time?
it's the first one in history. They might have been trying to make other ones. It is a newer technology,
Okay.
um, but I'm not sure if there were previous. I know it's a new procedure
Right.
doing to develop it. So yeah, there's some novelty there. Yeah,
And then how does the RNA, like, how does an RNA vaccine work as opposed to a standard? Because I know, like, standard vaccines, they're giving you a dead virus so that your body, you know, realizes that this virus is gonna hurt you, and it's gonna, like, it's gonna make you sick. So you give a dead virus to your body creates antibodies to fight against it, it understands what to do with it, it expels it. You may get a little sick because you're whatever, but then overall your immune or your response is going to be far less than it would be if you didn't take the vaccine. um but for
I
an
have
R, yeah, go
I
ahead.
haven't really read up yet on how the Pfizer mRNA vaccine works.
Right.
Although I'm assuming, no, I don't want to make assumptions.
No, he's like, nope,
No,
science guy, not making assumptions. The only thing I read, the only thing that I read was that it is basically going into your RNA and tricking your body into creating a protein that will, I'm not sure if it either makes you invisible to the virus, or if it simply just allows it allows the virus to pass through you. Like it kind of tricks the virus into thinking that you're not a viable host to house the virus, so the virus comes and then just kind of dies off because it never replicates because it feels like it's not a, and again, I know shit about science, I'm terrible at math, like whatever, so I don't know if that's true or not. I'm just basing it on like the little tidbits of information I've gotten on how that RNA vaccine actually could work. um a lot of people are scared though because they're like, this is the beginning of them turning us into, like, the drones of the one world order, where they're going to control our genome and they're going to, like, you know manufacture us. And I'm like, yeah, okay, calm down,
well,
buddy.
wait 2 seconds, and I'll take a look here. Because
Like,
I'm not scared of taking the Pfizer vaccine at all. In
no,
fact,
I'm not scared either.
as soon as it's available for me as a healthcare worker,
Yeah,
I'm take it right with no questions asked.
well, for sure. Because I
Uh,
mean, they're even saying now, they're like, well, there's a chance you're gonna get sick. I'm like, yeah, there's always a chance you're gonna get sick. Like,
oh yeah, but
so
the
what? Like, it's better
the
than
efficacy,
dying.
what people should know, and this I know for a fact, is like vaccines have an efficacy rate.
Right.
So some vaccines work better than others
Hmm.
for particular viruses. Um, so you might have a vaccine, let's say for some kind of flu variant or whatever.
Hmm.
They use that, and this particular strain that they developed the vaccine for might be only 60% effective for the entire.
Right.
And other times it might be 90%. Another strain or whatever, and 90% of people develop immunity to that particular strain of the flu,
Hmm.
um, or any other virus or whatever. Um, but even in a vaccine that we know is like 100% effective, or
Hmm.
90% or 95%, there are going to be people that don't respond to the vaccine at all. Like,
Right.
and I'll use myself as an example. Um, hepatitis B, we all got our shots,
Hmm.
right? Hopefully you have yours.
Yeah.
I had to get tested back when I was working out west in Alberta for a job that I had over there, and I had no antibodies floating in my blood. And I said, well, I got my hepatitis B shot back in high school or whatever it was.
Right. Of course.
And the doctor said, well, we're just going to have to do it again. So they did all three shots again, and still didn't have any antibodies. So then they gave me another booster, like just one extra. So I had 4 doses. And finally, my body kicked in and then I had total immunity again. So I either the vaccine that I got in high school didn't work at all, and I
Hmm.
didn't respond to the vaccine and never produced those antibodies,
Right.
or over time, it just my body got rid of that particular uh, memory cell, if you will, and
Right.
I needed to go through the shots again, which does happen too sometimes. It depends on the person. There's so much variation between each individual, uh,
Yeah.
but they can say that, okay, this vaccine is about 95% effective based on our study group, whatever the
Right.
study group was, 30,000 or 40,000 people or whatever it was,
Right.
that those individuals did. Now, what happened to the other 5%? They just didn't respond, or, you know, what happened there? So, that happens naturally in any vaccine. I just want, people to understand that.
For sure. Um. And then so in cases of, because I'm starting to read cases about, oh well, not read cases, but I'm starting to hear about cases of so these people are getting COVID. They get sick for a little bit. They go under, like, whatever, they're fine after, they get by it.
Mm-hmm.
So um my understanding of the process, because especially in the gym, we had to read up on, like, what the process was. Um so a person gets tested, they get COVID, they're supposed to quarantine for 14 days to allow the process to do whatever it's going to do. They then get tested again after the 14 days,
Mm-hmm.
to see if they still have it, or whatever the, I guess, whatever the viral load is still in their system, to see if they're still
Yeah,
whatever.
see if there's still residual virus still being produced in
Right,
body. You're clearing it out. Or
right. But so then, let's say, like, someone gets COVID, still has their test after the 14 days, and still has COVID. Um, One of the things that was a little bit, not, I'm not going to say disturbing, but it was a little bit shocking to me, is that even after that, if they still test positive, the government's not then allowing them to administer, like, to take a third test before they go back to work, or before they join back the general public, to assure that they're at a level where they're not going to still be like, spreading the virus to other people. So I'm like,
I wasn't aware of that. Is that in
yeah,
Quebec specifically, or
that it's in Quebec now, because I have, like, I've been in a situation, but I know of someone who is in a situation right now to where they had COVID, they got tested, after 14 days after, still registered that they had COVID in their system.
Mhm.
Uh, he asked what he's supposed to do. The government said you have to wait another, I think it was like 10 days before you go back out. He's like, okay, well then, after the 10 days, do I then come back here and then get tested again to see what it is? And they're like, no, we don't test you a third time. I was like,
Okay.
okay. And the problem that they're having now is their work is asking for a like, for a test. Same way, like, I don't know if you know anything about the NFL, but the way the NFL works is, if you have COVID, you go through your period or whatever, like, where you isolate. Then after that, they will test you 2 times. Like, basically, what has to happen is you have to pass 2 COVID tests negative within a couple days of each other
Yep.
to prove that you don't have COVID.
Yep. It's the
But
same policy for occupational health, like at any hospital.
exactly.
You'd have
So
if you tested positive, then you have to come back with, I think it was 2 consecutive negative tests, X number of days apart.
correct, exactly. So I'm just wondering, from someone who's in your position, who, studies these things and looks at these, tests, like, isn't that a stupid idea to not then retest these people a third time to make sure that they're not actually going to spread possibly spread more COVID, or is it just a situation from what we've discovered in the lab is that if someone's had COVID for that long, that they're not actually capable of spreading it anymore? Like, what is the lab number, or what does the
I
lab say?
well, I'm not speaking for the lab or
No,
anything.
no, I know, but
Speaking
like,
on my personal self, but
yeah,
yeah, like I would. That seems weird to me. I'd probably want to test. Like, if it
a
was
third time.
me that had
Yeah.
tested positive, I would want to make sure that I have a negative test before I do anything.
Well, yeah, that's it. It's just,
And so that seems weird to me as a policy in Quebec. But
yeah, it's weird because like I've been tested. I think it's 3 times now. One time I had a cold and I was like, ah, shit, got COVID. Went and got it. Didn't have COVID. It was just a normal cold. And then 2 other times I got tested after the kid came back from daycare. I got tested to make sure because there was a couple of kids who were sick. My daughter was sick for a little bit. So we wanted to get tested and make sure because she's going to daycare all the time. So the
Mhm.
school makes us, if they show the kids show any symptoms that are even minusculely similar to COVID, they have to go get tested,
Yep, it's the
and
same.
then we all have to go get tested as well. So like,
Yep.
because so we've been following that guideline, but I'm like, shit. So like, if I had somehow gotten COVID and then needed to get tested, like I can't get tested again. Like, even though the school is asking and telling us that we need to make sure that we've been tested, like we need to have a negative test, like that's kind of like short-sightedness on the government's behalf if that's how they're dealing with things.
Yeah, it seems like it to me as well.
Like that's
Yeah, like I don't get that one, but
that's weird. Oh, because I wanted to ask you that question because I thought maybe there was some science behind it saying like, well, if you've had it for that long, there's a good chance you're not going to spread it. Like in very rare instances,
that's
you know,
maybe possible. But I like a lot of the times I feel that we should be, you know, um, erring on the side of caution.
for sure, 100%.
Right. So
Okay.
that's always my instinct. So why wouldn't we allow that person or individual to get tested again?
Yeah,
Um,
like that's yeah,
you
okay.
know,
So that's what I
but
thought.
no, I agree. You know, like I think it's kind of silly. You know, we should
Yeah,
testing anyone who wants to get tested for whatever reason to, you know, but
yeah. Well, I mean,
that's
like,
not.
and so can you tell me this? So this is one thing. So the states had those I don't know what you ever want to call them, the instant tests there or whatever
Yeah,
for a
like the
long time.
20, 15, 20-minute tests.
Exactly. So they had that for a long time. And Quebec's reasoning for not making them accessible to Quebecers was they said they didn't trust the results.
Hmm.
They said the results weren't good enough or whatever. And I was like, okay, I understand. But at the same time, is some test better than no test? Like, if we're testing, for whatever reason, like if people like our example was, again, I'll give the example of the gym. What our one of our plans was is we were going to try to figure out if there was a way to get a hold of these tests, and what we were going to ask people to do if they opened back up again is that people would come, they would take it, they come 15 minutes early, they take the test, they'd wait, they'd show, if they're negative, fantastic. If they're positive, well, you know, go to the hospital, go get tested, whatever, we're good to go. Like, we'll deal with it that way. Like, is that in some case, is that not better than not doing anything at all? Or is the test was is it possible for the test to be so inaccurate, or just that it'll create disarray and it'll create paranoia more, like it'll hurt more than it'll help?
Um, yeah, I could understand that. I mean, it's not every single test is different in terms of manufacturers, right?
Right.
How they do it, how to actually do the testing is another thing too.
Hmm.
It's often referred to as a point of care testing.
Right.
Um, so you need to have trained people in order to how to do them properly. Those also have to be QC'd and calibrated every so often, right? To make
Okay.
sure we're actually giving out the results. But so there's a lot of background stuff that needs to be done to make sure everything's okay.
Okay.
I'm not sure what particular manufacturer test you're referring to. Um, just
I'm not. I'm not sure. It was some 15-minute test that they said that they had, and Quebec outrightly said like we're not taking this test because we don't trust it.
yeah,
So
I know there's I think Abbott does one that I've
yeah.
seen recently, but just generally speaking, I think there's a place for them for sure. Like
Mhm.
remote communities, that's a big thing in Canada, right? 'Cause
Right.
all these sporadic little small communities,
Right.
up north especially. Um, so there's definitely applications there. I could see airports or any kind of major traveling that has a definite
Hmm.
application. Like also too, you have to remember, they just came out with these tests. And
Yeah.
they're not able to manufacture everything for everyone, all at once, right?
Right.
Um, so it's about securing supplies in order to get how many kits and testing apparatuses that you need to go everywhere. If we had it for everyone, they obviously don't have the volume to supply it to absolutely everybody, so we have to
Of course.
focus the resources where it's most effective and needed. And
Okay.
like in a remote community where the hospital is like in a different province, or you have to take a plane, that point of care test would be handy for that small community of people, with a
Yeah.
village, 100, a few hundred people. That will give them something, to utilize. And the airport, that's perfect, right?
Yeah.
Because
Well, that would
you
make
want
sense,
you
right?
want a quick answer to get people through.
Yeah.
Um, yeah, so I definitely think there's an application,
For
uh,
that kind of thing.
but there's a you could definitely do that if we could secure it. Did you ever find out if you could secure any
So,
tests
well, no.
like
So the
that?
whole thing was that
That's
Quebec
what I'm curious about.
Quebec said that we're not like they were not going to allow the sell of the thing to like they weren't going
Oh,
to
at
allow
all?
anybody. No, like we could have ordered it from the states if we wanted to, and paid like whatever. But Quebec was saying like we're not doing it. Like it's not a viable test, so we're
Yeah,
not going to.
actually, you reminded me about a report I saw. I think it was on the BNN Business News Network. Is
Right.
going on about how um, the in the United States, at least at that time, I can't even remember how many months ago it was. Probably in the summer or something like that.
Hmm.
But it's like a free for all in terms of manufacturers that are just making different point of care tests, and it's not
Right.
really overseen uh, by the FDA or whatever
Yeah.
later. So like, I think it was New York or something like that in the article had purchased a bunch of these, and they none of them worked, or whatever the article was referring to. So there's like that element too
Hmm.
that kind of adds a different layer to what you expect. I'm not saying at Abbott Laboratories or any other major
No.
manufacturer
No. No. Yeah.
not producing the right things, but I think you get all these little kind of startups or whatever, and then it's not exactly, you know, functional, or it doesn't work right or whatever, and people think they're buying the good stuff. Like
I got you.
it's not exactly ideal situation right now.
I got you.
Put
Yeah,
it that
that makes sense.
way.
So yeah, so the last thing I kind of wanted to talk to you about, see, I don't actually know if you know anything. So Quebec laid out its plan for how it's going to administer the vaccine throughout the population. Of course, first they were going to do first are going to be like so people in long term assistance care,
Mm-hmm.
and they're also going to do first responders, frontline workers. But weirdly enough, the next people who they want to take care of or administer the vaccine to are people in rural areas as opposed to people in the city. Now, as someone who's kind of like looked at
Hmm.
the spread from a from your perspective, from the lab perspective, and seeing this, does that make sense to
They
go?
want they want to vaccinate just like long term care people in the
So,
rural,
well, so they're
or
gonna do. They said they're gonna do, people in old folks' homes.
yeah.
They're gonna get them first. People who are older. They're gonna do frontline workers, obviously, because they're exposed to it the most. But then the next group of people who they want to do after that are going to be people in rural areas. So people who live in small communities on the outskirts of, like, on the outer parts of Quebec. They want to do them first before they do the people in the big cities. So I'm like, from your perspective, and just kind of based on the numbers and stuff and everything, or from what you see, does that make sense? Like, is it not better to do the larger group of people first and then do the rural, or are they just afraid that the fact that these small areas don't have as much access to medical care, and that if they come in as well, there will be a bigger issue that will overload?
I, I,
Like,
I suppose that might be possible. Like, I, I'm not sure exactly why they're deciding it to do it that way.
yeah,
And that seems odd unless they mean rural communities like they want to do up north first, like First Nations or something like that.
right,
I don't know. I'm not familiar with that plan. As far as I know, here um, is they're doing exactly the same thing. LTC,
yeah,
long-term care facilities. Those workers that are at the LTCs,
yep,
and then it goes on to the other healthcare workers, frontline workers first, obviously, and then after that, it'll be like the rest of the healthcare staff,
hmm,
and then it goes on to the highest age group.
yeah,
But I mean, I don't think we've gotten that far yet, but I think that's
no,
going to go. Um, you know, so I mean, yeah, I'm not sure. That seems weird. Like, just go to the rural areas before you go to the cities. Well, what makes a 60-year-old out in the rural region
I'm
versus
I'm
a
really
60-year-old in the city? What difference does it make when like you have a
I don't
hospital
know.
in Montreal or Quebec City? You would
I don't
think
know.
you want to get as many people vaccinated as possible, regardless
Yeah.
of where you live.
The only
Um,
thing I can surmise is that they're afraid that if they have these pockets of people who get COVID, and they're going to have a harder time getting to these people and taking care of them,
yeah,
which would then allow the virus to, kind of mutate and grow exponentially. Like, it'll give it kind of like a free for all in an area. And I mean, as you know, obviously that's all a virus needs
yeah,
to flourish, is just a small pocket of people who are not, vaccinated or not dealing with things properly for it to grow exponentially. So
correct. Yeah.
I'm thinking maybe they feel like because they have less control in those rural areas that it's more important to vaccinate them first. But I just wanted to know from, like, if there was like some kind of science behind it that just made that make more sense.
I think that's more. Well, I think those types of policies are probably more driven by the government.
The political
I
aspect
mean,
of
there
it.
is obviously a science element to it,
Yeah,
but in terms of that particular specific issue, I don't see
I know
why.
it's weird, right?
I would just say if you're 60 and up,
Get the
or
vaccine,
50
for
and up,
God's
or
sake,
whatever
please.
the cutoff might be,
Yeah.
get the vaccine
Mm,
wherever you are. You know what
right.
I mean? But
Yeah.
maybe they just don't have the staff. Who knows? There's just so many possibilities there. I
Right.
don't know which one to pick. But hey,
And yeah,
hang on 1 second.
yeah.
Nanoparticle later. Okay, so basically, it looks like the Pfizer vaccine, they uh, take the mRNA that's responsible for developing a portion of the spike protein on the coronavirus.
Right. The one
Okay, and
that
that
supposedly was put in from AIDS there.
yeah. But yeah, so like whatever the spike protein on the surface, that little kind of spiky
Yeah.
piece there,
Right.
whatever sequence of mRNA that is responsible for developing that is
Hmm.
in this nanoparticle uh, in the uh, in the actual vaccine, and if that's injected, a cell will uptake um, that little kind of mRNA piece once it's
Hmm.
inside the body, and then a cell will produce that protein, and then your body will be like, okay, this is the part of the spike protein, and
Like,
now I build antibodies to it.
it's blocked, so then the virus can't actually
Yeah,
get
exactly.
into. It
And the
can't get into the
antibody,
cell.
once you've responded to the vaccine, you'll make an antibody that basically covers that spike protein, um, so that it won't go and infect the cell.
Understandable. Okay.
So that's just something I googled here, how
Yeah,
the
yeah.
vaccine works
Well,
there.
listen, the reason why I ask you is because you understand science way better than I do. So, like, at least if you're reading it, you can kind of understand from a cellular level exactly, like,
Well, I mean,
what is
like I
happening.
said, the mRNA thing, I haven't familiarize myself because it's a relatively new technology. Uh,
Right.
but and now I'm busy with the little one more
Right.
so than I
Of course.
I have less free time than I used to.
Well, that's it.
But
Right.
no, but a traditional, like you were saying earlier, a traditional vaccine is usually can be an attenuated, which is means dead virus.
Right.
That your body will build immunity to because of the surface proteins or whatnot. And some vaccines are live viruses that are, that give you kind of a mild version of it
Right.
to build immunity to. There's not
Right.
many live viruses anymore. There's
No.
more attenuated dead viruses, sort of thing.
Yeah.
Um, so yeah,
Okay. Cool. Listen, buddy, I thank you so much for clearing up some things and spreading some knowledge. Very much. I mean, I know our group there. Anytime someone has a question about, well, what about COVID? We always refer back. We wait for Ryan to respond so that we can properly understand what the hell's going on. But yeah, I'll let you get back to your little one, buddy. I miss you. I wish
yeah,
you
me
still lived
too.
in Montreal. But whatever, you had to go live in Ontario like a schmuck. But whatever, it's fine. I don't hate you that much. But
I
yeah,
miss you too, man.
th-
Take
thanks a
care.
lot for taking your
We,
time, buddy. Appreciate it. I love
yeah,
you. Give my best to the family,
I will.
and
You too.
hopefully shit goes back to normal so we can all get back together again and
Yes,
have
and
some fun.
I would just encourage people to just hold on tight for a few more months while we get everybody vaccinated, and then
Yeah.
things should slowly go back to normal.
I think everyone's kind of given the thought that like, okay, like we'll be fine. Everyone stays in their fucking igloos like we always do. But when summer comes around, like they got to figure something out because if they try to keep people quarantined for another summer, it's gonna be World War III out there.
Yeah, oh, I
So
agree. Well, I miss you. Thank you. It was a
yeah,
pleasure to speak with you today.
yeah.
So
Appreciate it, buddy. All right, so this has
take care.
been the Uncommon Sense podcast with Mr. Ryan Rosewell. Thanks for listening. Have a good day.
All right. Cheers.